Hello, everyone. Uh, Good morning, good afternoon, good evening, good night, wherever you are in the world. I am Alicia Jenkins, speaking from Perth in Australia. Uh, Welcome to the IDF Blue Circle event on World Humanitarian Day, entitled Advocacy in Times of Crisis. I'll first of all introduce myself. I'm trained as an adult endocrinologist, and I'm also very active in diabetes research. I'm the chair-elect of the International Diabetes Federation Western Pacific region and was very involved in the delivery of the Diabetes and Disaster Guidelines, which was released about two years ago, the second edition. I'm also a member of the IDF Disaster Committee. I've also been volunteering with a diabetes NGO, Insulin for Life, which has started off in Australia almost 30 years ago. I've been working with them for 25 years. I'm currently the president of Insulin for Life, and I'm also on the board of IFL Australia and was previously on the board of Insulin for Life USA. I'm also a member of various other advocacy groups with and for people with type 1 diabetes. I understand that we have 1,229 registrants with us for this symposium. Because I'm sure it's an uncivil time for many people, this webinar is going to be recorded, and all people who have registered for it will receive a link for the copy of the recording several days later. If people attend 80% or more of the webinar, they can also get a certificate of an attendance. Check your spam folder if you haven't got that, and you should have that by September the 6th. So reach out to us if you want that certificate and you haven't got it. There's no PowerPoint slides or scripted talks. This is a dialogue amongst the panelists and with the audience. So please, participants, please feel free to ask questions or make comments via the question and answer function by chat. And some of the IDF staff are going to alert us to the various questions, which we'll direct to individual or the group panelists. So I would now like to, we have a pre-recorded message from the IDF president, Professor Peter Schwartz from Germany, who has unexpectedly but kindly had to step up as IDF president after the recent unexpected loss of Professor Akhtar Hussain. So here's a message from Professor Peter.
Dear ladies and gentlemen, dear colleagues and friends, dear everyone attending today's IDF Blue Circle talk, Advocacy in Times of Crisis and Disaster. It's a great honor to open this Blue Circle talk, and it's a great honor because this is such an important topic. There are more and more disasters, there are more and more crises, and you know all of them, and there are more and more people with diabetes affected. And we have to act to help them. We have to act to develop disaster plans. We have to act to build a coalition of supporting people with diabetes and also others with chronic diseases in such a disaster situation. It's a great honor again to introduce Professor Alicia Jenkins, who is today your moderator and will guide you through this Blue Circle talk, where you can listen to experts from all over the world and from specific regions where disasters is and how those people develop patient advocacy in such a difficult situation. I welcome all the attendees, and as I said, listen to it and think about what you can do to help people with diabetes in a crisis, in a disaster situation, and prepare yourself if such an event happens, To introduce myself, I'm Peter Schwarz. I'm Professor for Prevention and Care of Diabetes at the University of Dresden, and I'm the President of the International Diabetes Federation. Normally, you should see someone else here, Professor Akhtar Hussain, who was our President of the International Diabetes Federation, but very sadly, very suddenly, very unexpected, he died a few weeks ago as he was at a Congress in Sao Paulo and was representing the International Diabetes Federation. It is a very sad moment, but I stepped in and I take over the presidency and the leadership of the International Diabetes Federation. And be assured, his project will be accomplished and we will go ahead as both of us had discussed. The International Diabetes Federation has one committee for crisis and disaster because we think this is a very important level to act in a sudden situation of a crisis or disaster. If you ask the question, how many people are affected? There are more than 130 million people being affected by man-made disaster in the moment. 10 or 15% of them may have diabetes, and a smaller fraction will have type 1 diabetes. And such a disaster situation will break the supply chain, for example, for insulin, and this can be life-threatening for them and have to be addressed immediately. But not only the supply of insulin, breaking supply of the water supply of food, disrupt also the personal life of the people, and the disruption of healthcare process, healthcare pathway may not only be a disaster for people with diabetes, but for many others having chronic diseases as well. So we have to think about how in such a situation, the supply of diabetes education, the supply of medication, but in many cases also supply of water and food can be poured to save the life of people with diabetes. Civil society organizations, for example, like the International Diabetes Federation, therefore calls governments strongly to develop disaster plans in such a situation with a disaster. And it must not be always war. It can be also migration, refugees, and a big storm, an earthquake like we had it in the past. They should develop plans to address a disastrous and crisis situation. But something what is for me personally very important and I could say an emotional topic. If in such a situation, medical aid will be weaponized, that means that medical aid is used as a kind of weapon or humanitarian aid is used in this. This is a development we all as civil organizations have to stand together to do anything against it. Medical aid, medical help, supply of water and food never should be used as a kind of weapon in a crisis and a disaster. The today's Blue Circle talk will address this, and you will talk and you will listen to active experts from Australia, from Lebanon, from Palestine and the Ukraine, and they will talk about how they advocate for people with diabetes in their crisis situation. And I deeply, deeply thank all the volunteers doing this, being active, being engaged to supply insulin, being engaged to bring insulin in the region with a disaster, organizing all the environment around contracts and drivers and address finding people who have the experience to distribute insulin. So a very, very warm thank you very much to all of them for their voluntary work. And with this, I would like to announce that Professor Alicia Jenkins, who is today your moderator, will take over the Committee of Diabetes in Crisis and Disaster at the board level of the International Diabetes Federation. And I think there's no one better prepared than herself, who has a lot of experience, a lot of passion and spirit to build a community and build a network of people addressing disasters and crisis situation. So I thank you again for having the opportunity to open this Blue Circle talk, and I would very warmly again invite you to come to the next International Diabetes Federation Congress in April 25 to Bangkok, and I would love to sit together with you personally and to discuss how we can make the work of the International Diabetes Federation better, and how we can build a community and network helping people with diabetes in a disastrous and crisis situation. So thank you very much for your work, for your interest, and I wish you a very good Blue Circle talk.
Thank you very much, Peter. And yes, I'm honoured to unexpectedly take on this role, and I will look to many. It's not an individual role, it's at building a community, an international community of so many people and organisations, including government, industry, transport people, advocacy groups, parliamentarians, individuals, people with and without diabetes, communication specialists, all are essential to help us prevent where possible, prepare, respond, and recover from disasters. So this hopefully will be a catalyst to get people thinking and coming together, preferably, before the next disaster is upon us. What I would like to do now is to have the other panelists introduce themselves. So there are four people. There's Dr. Irina Vlasenko, Dr. Mohammed Siam, and Ms. Cyrene Farhat Shur, and Dr. Frank Brennan. In that order, I'd like them to introduce themselves to you. Irina? You're on mute, Irina.
Hello, everybody. Thank you very much for invitation for start this topic. I'm Irina Vlasenko from Ukraine. I am Vice President of International Diabetes Federation. I'm also a board member of Ukrainian Diabetes Association and also associate professor in the National Healthcare University in Ukraine, and person who living with diabetes more than 30 years and last 2 years live in war, unfortunately. And of course, I member of a lot of humanitarian aid committee, and it's my subject now.
Thank you. Mohammed.
Well, again, thank you so much for the invitation. Happy to be part of this panel discussion. Mohammed Siam, I am a medical doctor from Gaza, Palestine, and I'm a person living with type 1 diabetes for 13 years now. I'm a young leader in diabetes, currently a mentor with the International Diabetes Federation, and I lead the Middle East and North Africa chapter at T1 International. Doing a lot of work as well around diabetes and in general non-communicable diseases in humanitarian settings, and currently based in London, pursuing a master's in global healthcare management.
Thank you. Busy person. Thank you, Mohammed. Cyrene, please.
So hi, everyone. I'm so happy to be here. So my name is Cyrene Farhat. I'm from Lebanon. I've been living with diabetes for the past 16 years. And I have to say, living in Lebanon is living in a whirlwind of crises and disasters. So it really, I think, gave me the drive to become a global diabetes advocate and to want to help people in my direct community and around the world cope with diabetes management and everything that comes into managing diabetes. I run a local NGO called Positive on Glucose, and we do have support groups that have actually extended regionally. I also have worked with several international organizations on peer support groups, and I'm currently doing my PhD on big pharma and let's say insulin access and ethics. So I'm really, really happy to be here. Thank you.
Thank you. Very, very relevant topics of study. Frank, please.
Yes, good evening. Hello to everyone. My name's Frank Brennan. I'm a palliative care physician based in Sydney. I'm also a lawyer with a great interest in human rights law. Alicia and I and others co-wrote an article in the last couple of years on human rights, diabetes access and human rights, international human rights. I was also a contributor to the IDF Western Pacific Disaster Relief Manual, and I'm an associate member of the IFL. But look, thank you so much, Alicia, for hosting this.
Okay. Well, thank you. So you've now met our panelists. We're just going to start off with one question for each of the panelists, a slightly different question sort of for Frank, before we then open up to everyone. But we'd like each of our panelists, in the same order that they were introduced, to spend 6, 7, 8 minutes describing a disaster in their region and the type of impact that it had and how it was dealt with. What went well, what didn't go well, what were the consequences? Irina, could you please start?
Yeah, I can. Unfortunately, we have aggression, Russia aggression. We wake up 24 of February from bombing. They bombing all of city of Ukraine, and it was and it started new reality. It was a lot of medical hospital and pharmacies was destroyed and closed. Many people displaced to another country and also to another region, but more west. And what is big challenge for people with diabetes, because we use some medicine which without we cannot survive, and this is big challenge from beginning, that we can lose this opportunity to have this medicine. But anyway, it's a system continue work, and we got a lot of help from abroad, and our associations also and other groups and individual and volunteer help people with diabetes, and this is a crucial role of our society to help individual, even because sometimes government cannot address help, and this is do our patient association. And this is main challenge. Another challenge, that mental health, this is also big influence, and there people with diabetes has not stable disease, and then we have and we recognize from beginning that we need more short insulin, and that it's I think it's considered by stress, and also less attention to another condition, and this is what many people with diabetes has a lot of different chronic disease which need treatment also. They have a challenge with them also, and of course new cases with increase because stress, and this is big wave. And I also afraid that a big wave of complication, which we know not now focus on this complication. Thank you.
Thank you. Mohammed?
Yeah. Well, I particularly come from Gaza, Palestine, of course, and we all have heard about the ongoing crisis in Gaza at the moment that's been going on for the past 10 months. And I always like to start by saying that how crises in general put an extra burden on the lives of those living with diabetes. Living with diabetes in a low middle income country generally is considered a fragile state where anything that could potentially happen would affect people's ability to manage their condition. And in Gaza at the moment, we do have periods of what we would call peace, but then definitely this only happens in between military escalations. And the crisis itself, again, is something that I have witnessed before. I haven't been in Gaza during this ongoing crisis, but I've been in a similar situation before where I wasn't able to access insulin, or I wasn't able to get the support that I would need as a person living with diabetes, whether from the healthcare system or from my fellow diabetics in the country. At the moment, with the crisis in Gaza, we always label people living with non-communicable diseases, and of course, among them are people with diabetes, as silent victims of war. As during crises or during wars, we'd see the attention going to acute emergencies. It would go to how the healthcare system is treating casualties. But then the primary healthcare itself is collapsed, and we'd see that people with diabetes or other non-communicable diseases are forgotten or are marginalized of the way healthcare is being provided. And that also includes the main and the primary healthcare providers in the country. So we'd have the Ministry of Health, and we also have a United Nations body known as UNRWA, the United Nations for Relief and Works Agency. Those are the main providers for primary healthcare, and that definitely, and what's going on has definitely affected their ability to support and to deliver healthcare services to the people. I've heard a lot of stories during the past 10 months now from people with diabetes whom I'm in contact with as part of a peer support thing where we try to educate them and support them. But we've heard a lot of stories about insulin, what I would call as insulin rationing, which is people trying to operate blindly when it comes to taking insulin, because they don't have any way to measure their blood glucose levels. They don't have access to test strips. They don't have access to glucometers. They can't just go to an emergency department, because emergency departments are filled with casualties because of the attacks themselves. So again, they're neglected, marginalized. They can't access the proper types of insulin. We've heard the stories from them where they had to. I personally know people who had to switch between six to seven types of insulin throughout the past 9 months. So switching between types of insulin, depending on what would be available, and additionally blindly taking your insulin without measuring your blood glucose level is something that we would call as emotional rationing of insulin. And then we'd go again from the healthcare perspective, we'd go to the point where how the doctors or the healthcare professionals in emergency rooms or in the internal medicine departments and hospitals would deal with people living with diabetes. And again, during a crisis, you don't have access as well to, and depending on the type of the crisis, you don't have access to lab tests where you'd be able to diagnose people with diabetes or diagnose people coming with an acute complication such as diabetic ketoacidosis. So people with diabetes would be, again, would not be prioritized in emergency rooms. You wouldn't be able to support them. You wouldn't be able to provide them with the healthcare that they, with the services that they need, and that would lead us to even more and more complications. Or probably, if you were able to provide them the treatment that they need, then that would lead to a vicious cycle. Because when they go back home or wherever they're sheltering, this means that they'll go back to rationing their insulin and then back to the hospital because they don't have any way or any measure of measuring their blood glucose levels. So in general, a crisis for people with diabetes is particularly about accessing the diabetes supplies that they need, and also being well educated about how to manage their diabetes or how to manage their condition during a crisis, especially when specific types of food are not available, when clean water is not available, how would I treat a hypo? How would I feel? What are the symptoms that I would feel while being in a hypoglycemia or being in a on a hyperglycemia? And that's something that we in the advocacy community around the world have been trying to support with by educating people, by giving them any form of education that they would use. I've been also in contact with doctors in emergency departments and sending them guidelines on using different types of insulin, how to switch between different types of insulin, how can you support a patient with type 1 diabetes. And also because of my close relation to a lot of the young doctors who are working in different mobile health clinics, we also have been providing them with some sort of lifestyle modification education where you can, again, talk to people and give them the basic needs or the basic advice on their needs in general. Now, again, catastrophic events and humanitarian crises, specifically, maybe if it's political, or if it's related to a war or a conflict, would paralyze health systems and would limit people's ability to get the care that they deserve. And in Gaza in particular, this has definitely happened. The healthcare system is paralyzed. Every aspect of life is paralyzed as well. And this leaves people with diabetes at what I would call a critical crossroad, where they have to deal with everything that any other member of the population is dealing with. And in addition, the extra stress and fear and the scarcity of diabetes supplies that would affect their condition by itself. And that's why for us in the diabetes community, it is a responsibility that we step up and that we support the needs of those affected by humanitarian crises, because in general, access to healthcare must never be politicized, and as mentioned by Prof. Schwartz, it must never be used as a type of a weapon in crises or conflicts.
Some common denominators there. Thank you, Mohammed. Cyrene, could you please share your experiences, please?
Hi, everyone. So again, I'm Cyrene Farhat. I've been living with diabetes for 16 years. Funny enough, I developed type 1 diabetes after a war that happened in Lebanon in 2006, and have had to live with diabetes ever since. And it daunted me always to think, like, how would I deal if we went through another war? How would I deal with diabetes? What's the thing that I would grab and run down the stairs or out of my house? I started the first support group we had with plasma glucose in 2020. It was during COVID. And funny enough, COVID was a blessing hidden in disguise, because it forced so many of us to stay at home. And we wanted to connect with other people, and that is how the idea of a support group started. And I would never have thought that this support group, who had people from all over the world, would actually help in one of Lebanon's biggest disasters. On August 4, 2020, we had the second biggest non-nuclear explosion in the world. It destroyed the city. It destroyed major hospitals around the city. It left a lot of people displaced, more than 200 people killed and thousands injured. And it had a direct impact on people living with diabetes, because one of the warehouses for the Ministry of Health were damaged, and a lot of medical supplies were destroyed, including insulin. And so this peer support group that had people from all over the world was helping us send insulin in bags from all over the world, test strips, supplies, glucometers, whatever you can think of. And honestly, seeing how support groups and people living with diabetes can actually come together and impact the lives of so many here in Lebanon, it still leaves me amazed, because we really can do so much when we come together. I have to say, going on the ground, door to door, seeing the needs of people with diabetes after that disaster was heartbreaking because so many people, especially ones with type 2, they really didn't have access to insulin because a lot of them were insulin dependent. A lot of people with type 1 were rationing insulin because they couldn't, at the time we still have financial crisis. So the currency had lost 100% of its value. I don't know if it's even more. So people could not afford actually to even buy insulin. There were problems with bringing insulin and like also like importing insulin because of all the economic currency devaluation problems. So people really had to ration insulin. A lot of people had to go back to NPH or like use insulins that they haven't used before. And because Lebanon was a very privatized system, people would go to private hospitals to kind of see medical professionals. They weren't able to do that anymore because they couldn't afford to pay out of pocket. And we did not have a healthcare system that was prepared for people to go into private primary healthcare clinics. So it was a disaster. It still is a disaster for the healthcare system. It's collapsed. It's completely collapsed. We don't have, up till now, a social security system that helps people access essential medical care. Everything is out of pocket. A lot of humanitarian organizations still try to help, but we have a very, very long way to go. The entire system needs to be, I don't know, recreated in a sense that it supports the most fragile in society, especially that we have a very, very increase in people that live under the poverty line. Up until now, we still do live in crisis. We have a war going on in the south of the country. I personally had to evacuate my home 2 weeks ago. And as a diabetic living in these circumstances, having to pay out of pocket, having to stock up on insulin if you find whatever insulin you need is very stressful. And I know so many people are all around Lebanon are living through that, are wondering what would happen if the war extends to their neighborhoods. I know a lot of people have been displaced from their hometown. They've migrated, they live in schools or they live in host homes all around the country, and they have very, very basic access to their insulin needs. So it's an ongoing crisis. I would say, I don't know when it would end. And similar to what Muhammad said, there's the surge of more and more people coming into the hospitals having DKA or having very high glucose readings. And if you're not insured, hospitals can't do anything about it, so they would just send you home. So it's very heartbreaking for me as a person living with diabetes and as an advocate to sometimes feel like no matter how much we do, there's so much more that needs to be done. And I really hope conversations like these help us create more sustainable solutions all over the world. Thank you.
Thank you, Sari. So we've got some common denominators of often things happen suddenly and can go on for a very long time, that there is breakdown of basic supplies of shelter, water, food, of the healthcare system, but also of government, or attention gets directed elsewhere. Even the attention of the healthcare system gets directed elsewhere, and essential medicines are not widely available. People have to ration their insulin, they have to swap, they lose their self-monitoring of glucose capacity, a lot of the labs. But it's pleasing to hear that there are people from all around the world, individuals and organizations who have and are trying to help, and that's what we need to harness that. I'd like to ask Frank, our human rights lawyer, with regard to what are the human rights laws that govern responses, particularly during man-made disasters, and who can people or organizations affected by these disasters ask for help, Frank?
Thank you, Alicia. I've been very humbled by the testimony of each of the panelists, and no doubt people online as well. So I'm just going to briefly go through perhaps the several layers of responsibility on individual governments and the world when it comes to health, and also more particularly in terms of then humanitarian crisis and disasters. So I guess the three layers are international human rights law, then international humanitarian law, and then refugee law. So in terms of human rights, one of the major, among multiple human rights in the UN conventions, is the right to health. So it's very clear in that document that health is a right, not a privilege. So it's really incumbent upon individual governments that have signed these international declarations to what they've called respect, protect, and fulfill that right to health, including in times of disasters. So, but of course, in times of disasters, there's an excruciating pressure on governments to be trying to manage things more broadly, but the obligation still resides there. It doesn't disappear in the time of crisis. The committee that oversees the main articulation of the international right to health did also talk about what happens in times of humanitarian crises. And they said, okay, it's not only the individual countries' ongoing obligation to preserve, protect, fulfill the right to health, but also three other groups. First of all, other countries. There's a sort of a sense of a collective responsibility here. The second are international authorities within the United Nations, particularly the WHO. And thirdly, civil society. So that would include, of course, pharmaceutical companies, etc. So that's international human rights. Then international humanitarian law is essentially the Geneva Conventions, very famous conventions set up what happens in the time of armed conflict or military occupation. So the international community, through the Geneva Convention, said even in that context, it still obliges all parties to provide health care, including to civilians, that's very important, of course, wounded combatants, and prisoners of war. So that's another layer of obligation on governments. The final layer of obligation is international refugee law, where the Refugee Convention does talk about the importance of maintaining good standards for the treatment of refugees, including healthcare. And throughout what I've just been saying, those three layers, whenever I've mentioned healthcare, of course I include diabetes care and all aspects of diabetes care. And you've heard from the three other panelists about the elements of diabetes care. So there's, if you like, a structure in terms of obligations on governments, not only the government that's in the midst of this crisis, but other governments, the United Nations, including the WHO, and civil society. So it's very interesting how widely scope that healthcare is. And then we've got the issues of international humanitarian law and international refugee law. Realistically, these are constructs that are more than constructs, because they have been agreed by most nations in the world as part of their international obligations. It's just a question then of how nations do fulfill, protect, and respect those. And that's really a question of the crisis itself, reporting to the committees that oversees, particularly the committee that oversees the international right to health, the UN Human Rights Council, etc., and bodies like the WHO. So I think that there is that construct, if you like, of how things are. Alicia, would you like me to go on and speak about whom to turn to, or shall I wait to speak a bit later?
Perhaps you could just briefly mention who the order and who should individuals or organisations approach within their country, then external. Because unfortunately, as we've heard, there's all these external bodies and laws, but they don't act in a timely manner. And particularly for people in type 1 diabetes, they need insulin and often other medicines in days, not in weeks or months. So particularly where there's a lack of supplies, what are the organisations who could be asked for assistance?
Yes, this is an extremely important question, isn't it? Because while we have that structure, if you like, of international human rights, humanitarian refugee law on the ground, in the middle of a disaster, at the beginning and throughout the disaster, people are going to need immediate attention, immediate care. So I guess now I'm moving into a very practical domain in terms of who could a person experiencing, living with diabetes, or families or diabetes associations. So let's go through this, perhaps in order. The first part of this story would be to turn to your National Diabetes Association and see what is happening, what possible role does the National Diabetes Association have in terms of helping individuals and collectively people living with diabetes. Secondly, in fact, I would say simultaneously in terms of this, people need to turn to their National Disaster Management Organisation. So all nations should have one. And if they don't, they need to, the response universally is to set up a National Disaster Management Organisation. So as part of that, the question to that organisation is, okay, you've got a huge number of things you're needing to deal with, but as part of that is healthcare, and as part of that is diabetes care, with a great emphasis on the fact that people are going to die very quickly for type 1 diabetes without insulin. So that's an absolute imperative for those two, the National Diabetes Associations and the National Disaster Associations. Then the next thing is, if this is not working, if you are not getting a decent response from these groups, then there needs to be a turn to the international community, and perhaps that comes in 3 layers. First of all, other countries. What can other countries start to provide and fairly quickly? An example that's just recently been announced in the Western Pacific is that Australia and New Zealand have now going to put up funding for essentially emergency warehouses in 15 countries, Western Pacific and Timor-Leste, which would then house material, including health material, to deal with the first 48 or 72 hours of a disaster prior to other countries being physically able to get into your own country. So that's just an example. The next are the international NGOs, the aid organisations. Many people online are part of this. That would include, of course, the Red Cross, the Médecins Sans Frontières, Direct Relief, and IDF and IFL as well. So what can those bodies then do in that situation? And then, not finally, but I think simultaneously to other nations, international aid agencies, the international UN agencies. And perhaps the 2 most prominent working here are the UN Emergency Relief Coordination, the ERC, and also the UN Interagency Standing Committee for Humanitarian Action, IASC. So those 2 bodies really are bodies for the international community to turn to. So in terms of priority, straight to your National Diabetes Associations, straight to your National Disaster Management Organisation, and then start to seek help from outside your country, other nations, international aid agencies, and the international UN agencies.
Okay. Thank you very much, Frank. I'd like to point out for people that there's a lot of this information, including some templates about what sort of information, when you're asking for help, that can be helpful to give. In the IDF Western Pacific Region 2nd edition Diabetes Care and Disasters Manual. So this manual doesn't show up very well here. It's available free, 223 pages of it, so quite comprehensive. It's available for free download from the IDF Western Pacific Region website, and also from my research group's website, ajenkinsdiabetes.org, but it's at the IDF Western Pacific Region website. And that has a list of all of the organisations, along with suggested tasks for individuals, their family, their community, healthcare professionals, health organisations, along the structure of prevent, prepare, respond, and recover. Irina, would you like to I see you'd like to
Yeah,
add some
I will
comments.
do. Thank you very much. First of all, I would like grateful to you, Alicia, because your a document which was very helpful for us for Ukraine. I use this very much. Thank you very much. And I also want to thank you very much, Frank, for your explanation about patient rights. But I would like to underline that we have a lot of documents which have already development for about patient rights, and also I have underlined of some documents which, like Boston Declaration, that it's specific for diabetes care for people with diabetes, and that Sea Declaration, which put attention on refugees with diabetes. This is very important, but I would like to address to everybody that document is great that we have, but without our advocacy, without our communication and work together, it will be only document, which maybe sometimes it's not work. And very often this document is not work for deliver humanitarian care. We know we have some occupation territory within from beginning, we cannot deliver, not authority can deliver, and also not another international organization can deliver help, and also like Gaza and so on. This case, I only would like to address, we will be together and communicate and push our who really take care about this, because it's not enough developed document. Thank you very much.
Okay, thank you. I gather there's quite a lot of questions and comments rather than in the question and answer in the chat section. So there's a comment from someone living with diabetes that says that while we can make demands on governments, we must take good care of ourselves to the best of our abilities. And being educated about diabetes at the best of times, but also being prepared for a disaster is important. And that it's important, but people also need to be in a healthy and well state in order to advocate for themselves and other people during the times of stress. And often there's costs involved. Someone is recommending and thanking the IDF for the free education resources that are also available from the main IDF website that could be helpful. Someone has asked us to repeat the name of the book. It's the Diabetes Care and Disasters, the IDF Western Pacific Region, 2nd edition, July 2022. Perhaps could some of the IDF team pop that in a link to that in the chat, please? But you know what? The best guidelines are local guidelines. So these are a fantastic, comprehensive guideline written in English. And they have drawn examples from different countries and cultures with regard to suggested checklists that Cyrene was thinking. She was thinking what she would run out of the house with. There are checklists for that from different countries and different cultures. But please look at these, perhaps form a working party and get them optimized for your region, your country. Then they will be even more valuable, and do it preferably not in the midst of a disaster. There's a statement that if you're the first time you pick up the disaster manual is during a disaster, then it's too late. I think it's better late than never, but nevertheless, that's an important issue. Thank you. Daisy has added in the chat the link to the document, And there's also, which you'll find mainly on the ajenkinsdiabetes.org website, a collation of many of the other regional documents from China, from Japan and Taiwan. And if you do develop any documents, please share them with us via the IDF so that we can make them available. So that sharing knowledge is important. Together, we are much stronger. One of the questions that's been asked is about the availability of insulin. How important is the cold chain? And again, that's one of the things that has now been formally studied and is addressed in the disaster manual. So yes, ideally insulin is kept refrigerated but not frozen, usually between 2 and 30 degrees Celsius. But fortunately, insulin that is not kept as cool as desirable does not become toxic, and it does not lose much or very little of its potency, even at fairly high temperatures. And there's been studies done by Doctors Without Borders and the University of Geneva studying a wide range of insulin, showing that even in tropical, hot and humid conditions, the insulin is still active. On the other hand, if the insulin becomes frozen, that does inactivate the insulin. So if the only insulin that you've got is that in a disaster is that has not been refrigerated, but it has not been and it has not been frozen, then in a disaster it is safe to use. And similarly, the questions have been asked: what if it's out of date? If it was a choice of an out-of-date insulin versus no insulin at all for someone with type 1 diabetes, again, it gradually loses potency, unlike other drugs, which can become toxic when they degrade when they get out of date. Insulin does not. So, but certainly we should try and maintain the cold chain, but just think, people with type 1 diabetes are told to keep the insulin vial that they're using for the next 28 days at room temperature. So that tells us, but now there's the University of Geneva, and also there's a Cochrane review study that came out that showed that unrefrigerated insulin is safe to use in a disaster. Okay. Looking for some additional questions. Someone has asked, is there a checklist for looking after your feet and accessing good quality footwear? These issues are often overlooked due to more pressing and competing demands. Social determinants of health are a big concern. Foot care is certainly is always important for people with diabetes and people without diabetes, particularly during disasters where there may be a lot of debris. Cleanliness and hygiene, maybe bad infections are more common. So that's why in most checklists they say having a sturdy pair of shoes is ideal. So having some good shoes and good all wool or all cotton socks in your disaster kit is good. But as some of people have alluded to, unfortunately for people in where it's a very sudden disaster or they're in a low income region, it can be very difficult. You're just surviving day to day to have your emergency kit. And this is where we need groups to help each other. Okay, someone has asked saying they do not have any glucagon in the Ukraine, and is anyone able to help? So glucagon, obviously essential for severe hypoglycemia or the risk of, such as with severe gastroenteritis. So I would suggest reaching out to the aid organisations. In particular, direct relief can be very, very helpful. Insulin for Life does get some supplies of glucagon, but not a lot. So I would reach out over the internet. There's a form to direct relief to see if you can get some glucagon. Can we work to find a way to work together to motivate people to change behaviours to help prevent type 2 diabetes? That's fantastic. If we can, it's very challenging, I think, even in the non-disaster time. But as Irina said, during a disaster where there's extra stress, we know that not only that there's new onset type 2 diabetes because of the disasters. Does anyone else on the panel have any suggestions for that, particularly for type 2 diabetes care, which of course can get be newly recognised, can start, be newly recognised and become very badly uncontrolled during the stress of a disaster? Would someone on the panel like to comment, please? Irina.
Thank you very much, Alisa. It's a good question, to be honest. This is big challenge for even for not humanitarian time, disaster time. But also, I think it's very important awareness, spread environments about diabetes, continuous spread and push and put attention that it's maybe more cases during the disaster and share information which is symptoms of diabetes. And these people who feeling these symptoms can go to doctor and pharmacy, ask them, because sometimes pharmacists only one person who available for health professionals, and this is pay attention. But from my side, it's very important. This is of course it's great way to do this, but for me more attention people with diabetes on this condition. Yeah, I know that it was very difficult focus on your health, and this is when war finish, we can care about ourselves. If it was too late, and this we must. It's hard, but anyway, we must care about ourselves. I like these comments which someone say that it's our life, and we must be educated. We must do something for themselves, and this is help to us. This is make change, and this is good for future, not only for us and also for our family, and of course for country. But my attention on yourself, educated, and have some knowledge how you can manage. And of course, I know that many doctors have free online consultation. Ask them. A lot of doctors volunteer would like to help you. This is, but please do something for yourself. Thank you.
See, there's a comment with a statement about it's very crucial to have strategies and restrictions on various medication for people with diabetes or medications for weight loss, such that people with diabetes who need them for their glucose control can't get them. And that's particularly relevant during disasters. And indeed, that's something that the healthcare system, particularly the pharmacy guild in disasters, can often assist with. I know in Australia during COVID, there was a rush for people to stock up, particularly on insulin and many of their other non-diabetes related medications. And so the government and the pharmacist limited the amount of insulin and other key medications, particularly ones that were likely to be in short supply, that people could collect at a given time. So I think that is something that is wise. And similarly, ketone testing strips are essential for people particularly with type 1 diabetes, but people with type 2 diabetes can also go into ketoacidosis. And a lot of people following ketogenic diets who do not have diabetes are keen to use them. So our pharmacies have been able to restrict them to the sales or provision of these strips to people with diabetes. So it's particularly important during a crisis that the organisations do protect the availability of essential medicines for people who need them, and allow enough, perhaps with a little bit of reserve, but not allow some individuals to just specifically, sort of stockpile. Okay. Someone has asked about diabetes distress. And of course, as some of the panelists have alluded to, and many in the audience would know, there's diabetes distress, which has many elements similar to anxiety or depression, and is quite common in people with diabetes and can come and go, and is usually associated with worsening of mental well-being, but also of physical well-being and long-term risk of complications. Not surprisingly, diabetes distress could get substantially worse with all the added stresses of a disaster. And also distress can also affect the volunteers. There are some sections in the Western Pacific Region Manual about looking after the mental well-being of the volunteers and of people with diabetes. But we've got some people here on the panel with lived experience and linked with various NGOs. Would some of you please like to comment? Cyrene?
So basically, as someone who actually lives with anxiety and depression, I can say that it's not easy living with a chronic condition, because on the average, on a normal day, we have to make, I don't know, an extra 100 decisions a day just to manage living with chronic condition, diabetes, and life. Add on that the stress of living in this region, the Middle East, and everything that is very volatile and very unpredictable. You end up living in survival mode and anxiety. I think Muhammad also can relate to the stress that comes to living with diabetes in a place like Gaza or Lebanon. That's part of why we had the support group, because we felt like people living with diabetes needed to connect with other people living with diabetes, because as much as medical professionals can come in and help, sometimes what people need is true connection with others that really know what lived experience is like and what it feels like to live with anxiety resulting from diabetes, to live from hypoanxiety. I don't know if this is a medical term, but I know it's real, or from living with diabetes burnout or with diabetes distress, or just feeling like you can't go on with who you used to be pre-diabetes. So it's very stressful. And I think we need to approach the whole diabetes concept differently. And it really starts from diagnosis. It goes with how you educate people mindfully about working on living with diabetes, because this is something they're gonna have to live with throughout their entire lives, whether it's a peaceful life or a life of stress. And the more we help people cope and mentally become strong and able to surf the big emotions that come with coping with such a condition, it becomes easier to cope with other things that come along the way, like disaster, like crises, all these things. And here I want to second again the importance of peer support, in my opinion, to really have somewhat of a healthy life where you're able to decompress on a regular basis and feel like you are normal in a like in the community that you live in. And I also would like to invite Muhammad, maybe also if he wants to comment on this, because I know he has also worked in a lot of your peer support groups.
Yeah, definitely. I've had my hand up for a while now. I just wanted to comment on multiple notes actually. And probably what would be really important to also think of when it comes to crises, especially if it's a sudden onset crisis. So if you expect a crisis, maybe as a person with diabetes, you'd prepare your own survival bag where you'd have insulin or the supplies that you might need. But on a sudden onset of a crisis, and that's something that we've seen over the past couple of years in Morocco or in Turkey with the earthquakes, for example, or in Pakistan with the floods, people wouldn't have the chance to prepare themselves for the crisis that is upcoming. They'd leave their homes, they'd leave where they live to a safer place without their, for example, insulin or without their medications. And I believe, and I've discussed this before with a few professionals, that during normal times, it's mainly the responsibility of the patients themselves to manage their condition. But in crises, especially in the sudden onset of a crisis, it becomes more of a responsibility to the healthcare providers to provide patients with what they would need when it comes to supplies, when it comes to the support or the education that they could potentially need. And I think here it's not just the healthcare professionals themselves, but also the link that would potentially link professionals with patients. And here comes the community workers and the volunteers that are working, hopefully, to support patients and to support the healthcare system that's trying to provide services. And generally, when it comes to education or advice about living with diabetes, it's generally lifestyle modifications, and how can we live a healthier life, even if there's a crisis. What's available, and how can we use what's already available? If there isn't, for example, if there's a power cut, how can we store insulin? If this type of insulin is not available, how can we support ourselves or treat ourselves with a different type of insulin? And again, here I think it's mostly yes, the community workers or the volunteers, and definitely the peer support groups, because it is important for people with diabetes to feel that they're not alone, to feel that they're heard, to feel that they've got someone else who can understand their feelings, understand the problems that they're facing. If I mentioned that the stress is causing me a lot of hyperglycemia and I can't manage my condition, probably a healthcare professional wouldn't have the time or the capacity to think about it. But another person with diabetes or a community worker would be able to understand this situation and provide at least some sort of emotional support to people with diabetes in such circumstances. So yes, guidelines are important. Yes, the advice is important. Yes, we want to prevent type 2 diabetes, but again, it's about how can we tailor all the needs that we have to the context itself and make sure that it fits and we're delivering something that the people need or prioritize, and we deliver it through a way that is not overburdening whether the healthcare system itself or the patients or any link that's in between.
Thank you. Could we please answer a question, and fairly briefly, please, we've got a bit, as we're getting close to time and a bit more to cover. Can you please share about some successful initiatives that got essential resources for people with type 1 diabetes during a crisis in your country? And how can we replicate these in other regions?
I'm happy to start.
Mohammed?
Yeah, sure. Okay, so during the ongoing crisis in Gaza at the moment, and how international bodies were trying their very best to get diabetes support into diabetes supplies into the Gaza Strip for the people in need, we in the international community thought that we'd work as kind of a facilitator to the international bodies that are working to support people with diabetes by connecting them. And I think this is one of the things that we in the community always think about when we want to address things differently, or we want to at least bridge the gap among different stakeholders who are trying to provide care for people with diabetes. So, for example, if organization A is doing something and organization B is doing the same thing, then we'd advise both organizations probably to work together or share advice or share the experiences of how were they able to get the supplies into the Gaza Strip. And that has helped us a lot and helped, of course, the healthcare providers and the facilitators to get the supplies into the Gaza Strip, navigating all the problems that they might face and leveraging those kind of experiences from each other. Additionally, we tried to liaise supplies with different medical missions that are getting into the Gaza Strip to get those supplies with them, and even if it's kind of a small quantity supply books, but at least it's something that could potentially help people and alleviate some of the burdens that they're living. So again, generally, for us in the advocacy community or the international community, it's about advocating, it's about supporting, whether online or on the ground, what resources might they need, how can we get supplies in, how can we connect and bridge the gap between different or among different stakeholders, so we make sure that that things are working closely and we're getting progress in the work that we're doing.
Thank you, Mohammed. We're getting so many questions and comments coming in. And we're not going to be able to answer all of them, but there've been 2 previous webinars about diabetes and disasters. So the IDF team is going to put the links in the chat where people will be able to go to those free webinars and can hopefully get some of those questions answered. There's another question about to expand upon some of the specific challenges we've had when advocating for diabetes care during a crisis. First, and working with Insulin for Life and also with the IDF, I would say there's a lot of resources that are out there. There are so many individuals and organizations and industry who are prepared to provide supplies. But what we need, which is heartbreaking and life-threatening and life-losing for people affected in the disaster, is where we cannot get the information or the contact. This is where in this disaster-affected zone or nearby, who it can go to, where it can go to. And as was alluded earlier on, that's only become a problem in recent years, although it certainly happened during the Ethiopian civil war, where there's this blockade of the medical aid, as Professor Peter Schwartz mentioned. And that should not happen, but things that should not happen still happen. And we as an international community, whether we live with diabetes or not, should call that out and do whatever we can through our links with parliaments, with politicians, with aid organisations to stop that. But sometimes it's the power of the pen and the keyboard. And blockade into Ethiopia was broken by the media, social media and the newspapers, initially in the UK, picking up the story that people were dying there with type 1 diabetes because the insulin that was available wasn't being let in. So that's one of the biggest challenges at the moment with this weaponisation of medical aid. And Frank Brennan and I, Peter Schwartz, and someone from JDRF with lived experience, and the IDF recently published a commentary about this. The IDF and people, we don't take sides in the politics. We take the side of the person with diabetes who needs help. And that's the most challenging and frustrating thing, because I have been so overwhelmed with the amount offers of supplies and help and knowledge sharing and donations of money to get supplies in. But when the supply chain is blocked, or they're all repeatedly blocked, that's what makes it difficult.
Can I add something about this? Like IDF, from beginning of, I think every situation, IDF very aware, try to awareness and have communicate during different channel with different level of authority, have communication and try to push and this possibility to deliver some supplies. It was, I know from beginning of war, and it's our ex-president, Professor Bolton, have a lot of, spend a lot of time for each different authority, different country. We send a lot of letter to different government and parliament who can help to us. And also it was happens during another crisis during Burundi and in Sudan. This is what we can do and how we can manage. Without our voice, it was not happen. This case, we must be together and different level use something for our general work. This is very important, be together, what I said before. And it doesn't matter where you are, because it could happen everywhere. It's not only about war, it's about different disaster. And what I feel, and I would like to express my gratitude to all of our diabetes community that helped to us and send a lot of support from beginning of war and during now. And our neighbors country who IDF Europe organizes a solidarity page for our refugees. This is also very important. This is some initiative, different initiative can make big input on life, on a concrete individual life. This is, don't forget, do something, be creative. And this case, it helped to people, not thinking of a simple way.
Well, a question and a practical suggestion is, do we think it would be helpful for advocates and individuals to contact their elected representatives in their country to ask what support their government is giving to people in conflict and disaster zones?
If I could answer that, I'd say definitely yes, because through probably our experiences, all of us here with the humanitarian settings, we know how trying to push forward for something, and the example that you've just mentioned, Professor Alisa, was amazing. Just how media was the reason medical aid blockade was alleviated in Ethiopia. It just shows that the constant pressure that the advocates could potentially put on politicians or policymakers could make something happen, and could change the reality that people are living or suffering from in humanitarian crises. And this definitely puts an emphasis on how can we involve patients and people with diabetes and advocates into decision making, or into talking to different stakeholders and putting them at the stakeholders table and in deciding what could potentially happen, because we need to hear about the needs of the people from the people themselves. It's not about us deciding what could potentially happen without listening to the actual needs from the people. And when we address challenges, and I think this is also important. Yes, we have a lot of resources. Yes, we've got a lot of stakeholders, different organizations working on a specific topic or a specific solution for the crisis itself. But what we must always have in mind is that humanitarian crises, as different as they are, different contexts, different reasons, they are complex problems. And we cannot just solve a complex problem by talking about it. A complex problem would need a complex solution. It's not just a simple mathematical equation. We have to get all the efforts aligned by all the stakeholders to ensure that we can do something. And yes, it would be hard because it's complex, but this is how we move forward in such complex settings.
So definitely it takes a village, a global village, for change. And so what I'm hearing is, yes, we should talk to our elected officials, to our governments. There is an organisation called Parliamentarians for Diabetes that's existed for many years, and they have a website. And I think Adrian Saunders is from the UK is very much involved in that. There are many previous members of Parliament involved with it, so they have knowledge and contacts. So that would be one, but I think approaching our own organisations would be good. Also, you're never too young to get used to approaching our elected officials. So the Life for a Child website, we had a webinar and we have published a book mainly for children, adolescents, young adults, or for even I learned from it, and I'm certainly not a young adult anymore, about how to go about advocacy, including interacting with your government officials. So that is available free from the Life for a Child website. And Frank Brennan and the Life for a Child team were very involved and essential to delivering that format with a lot of practical suggestions. So just in the last, just if we could go around each of the panelists, and very short answer, please. What's the top thing? What policy or thing would you like to see implemented or changed so that people with diabetes in the inevitable future crises are better supported? If you could do just one thing, what's your wish? Cyrene?
That's a very tough question, actually, because when there are so many needs, it's hard to pinpoint one. One thing that I can say is based on my experience in advocacy for the past 5 years is I really wish stakeholders would come together and actually collaborate on one solution. So many organizations work in parallel on sometimes one objective. If we all can come and work together to synergize and actually find that one solution for all, I think we can. It just takes some, sitting around the table and being open to discuss things. So that would be my take on this question.
Very wise. Frank, what would be your one wish?
I think I do think having listened to this session, I think coming back to the National Diabetes Associations, for them to make this story of what happens in disasters, humanitarian crisis and conflict, a key part of their work, how they envisage, imagine, what they can learn from their experience of other national associations to prepare ahead. I think that's an extremely important part of this.
Okay, thank you, Frank. Mohammed, your one.
I think my note would be, how can we increase accountability and provide feedback loops from or among different stakeholders who are working on a specific topic. And I think accountability is a major issue here, because if we're working on the same thing parallelly, we're not working together, then that's an issue where something could reach people, but it's not from that organization, and the way organizations deal with each other or deal with people is an issue. So accountability and feedback loops, I think, are really important to build on better responses for the future.
Yes. Thank you. Irina.
Yeah, I agree with everybody. It's a lot of great point. And I think it's, according to my experience, I think it's very important work special with stakeholder and decision maker who really can influence on situation. This is in our side, it's government. And our work is very great that we can collaborate with some international organization, but anyway, without government, it's too complicated to implement. In this case, it must building good collaboration with government and national association must be a strong voice in this collaboration. This is very important, and government must understand how great work with national association. It's very useful for use, and that from my side, when I collaborate, from beginning it was maybe not so super, but then step by step they understand that our help, it was really, and we bring information from the reality situation. They have, of course, information from doctor, from another resource, but we bring information, and this is collaboration is very, very important. And also transparency is very important. That is, if you, because it's financial, it must be transparency where this money go and for what.
Okay, and going back again, even shorter questions. We've talked about the transparency, the communication, the government. How can the global diabetes community better prepare for future crises so that they can support individuals with diabetes? What's the one thing that you would like to be done? Sorry.
Oh, sorry,
Mohammed? No, Mohammed?
I'm sorry.
I had to go first last time.
Yeah, as short as it could be, we have to hold a proactive approach in advocating for diabetes in crises. We must never wait for a crisis to happen and then start advocating for it. That's number one. And again, going back to what Frank has mentioned before, health is a right, it's not a privilege. And we should have this in front of our minds whenever we advocate for diabetes. This must be the number one rule. What we're advocating for is our right as human beings. And we must hold everybody accountable, again, to protect, respect, and fulfill this right.
Okay, thank you. Cyrene.
Yeah, basically one thing I think that we worked on from the whole Gaza situation, like we had this open discussion on, again, what would I grab if I'm running out of my home and if I have enough time to grab it. And one thing we worked on was a very small study to see like what a T1D grab bag would look like, what would be in a emergency kit that was provided by international humanitarian aid organizations. So it's in the booklet. Yeah, so we actually we reached out to people around the world to see what they grabbed, because it differs from region to region. I wanted to consolidate like one bag where, based on different actual disasters that people have gone through, like what did they actually put in that bag, and maybe advocate for international organizations to create that bag and give it to people in crisis, so the next time there is a crisis, we are ready to help people with type 1 diabetes.
Individual preparation and sharing of that knowledge would be fantastic. Frank? What's the one thing that you would ask, you would hope for people with diabetes, for the global community to help support them?
Oh, well, look, I think what's happening there with the IDF having a disaster focus, I think, is extremely important. But those insights, that so many of the insights of tonight are disseminated widely across diabetes associations around the world. And I loved a couple of comments in terms of creativity in often the worst possible situations. How can you possibly do things? Well, really, it's common sense, but creativity, and then advocacy, as we've spoken about. So I think at that international level, WHO, all the international committees that look at human rights, of course, for them to focus on this, but then this focus across from the IDF downwards.
Thank you, Frank. Irina, short answer, please.
I think, yes, I also a little bit feeling responsibility, because I'm like vice president and member of a disasters committee. From my side, this is very important, quickly response. But for quickly response, we must be prepared. And this, it will be organized some network with practical solution. That if something happens with different country, they can call to us, and then we have already know someone who can help. This is very important, quickly respond, because disaster not wait when we will be ready. And of course, I agree that every person with diabetes should care about yourself and preparedness, because maybe someone, even nobody can help you, but you must be responsible for yourself. That's all. Let's and I would like to say big thanks to everyone to help our people with diabetes.
And thank you to all of the participants. So many questions and comments. And thank you to our fantastic panelists who unfortunately have a lot of lived experience amongst them that is still ongoing. But again, as Irina has said, with diabetes and disasters, it's not if, but when, be it man-made or a natural disaster. So thank you to all the participants. Thank you to the IDF for arranging this, for the IDF team of Daisy and Bea and Bruno and the team for helping organise this. I think my take-home summary and is that to think diabetes and disasters, not if but when, to prevent where possible, such as vaccinations for infectious diseases, to prevent, to prepare, absolutely prepare at individual, healthcare professional, government and international level, including know who to ask for help, to respond well, and then to recover, to also be accountable and to reach out to the global community and also to our governments and elected officials. And please include the IDF. We're well connected. We want to become increasingly well connected to be able to help in real ways. So thank you very much.
Thank you, Alisa, for moderating this great webinar. It's and also a professional answer for many questions which we have from audience. Thank you very much, a great moderator.
And just as a reminder, the recording, slides and feedback questionnaire will go to all over 1,226 registrants in the next few days. Please respond to them because we're really trying to step up. We have to step up. We want to step up the IDF's contribution and linkages with all of the many organisations, individuals, people, so that we can help reduce the devastation of what disasters can do. Please send any questions or comments you have to advocacy@idf.org, and you can sign up for the IDF newsletter, and there's a QR code there. So thank you very much. Now, I suspect, the IDF World Diabetes Congress is in Bangkok in Thailand in April. And yes, there will be lots of programs, scientific sessions and international speakers. And I think many of us here will be absolutely determined that there will be an update or progress on where we're at and what we still need to do, and searching for new ideas and connections of how we can reduce the burden and the devastation that can happen for people with diabetes and others from disasters. So good evening, and thank you very much, everyone.
Good evening. Thank you.